Hamilton is past the peak of Omicron and witnessing a decline in COVID-19. That's according to Public Health today. But as Ontario is looking to drop the mask mandate in the weeks ahead, the city's COVID-19 operations chief is warning residents to remain cautious. Nicole Martin reports.
While Hamilton is past the peak and witnessing the decline of the Omicron-driven wave, we anticipate the risk of transmission will remain high through April as public health measures are lifted.
Michelle Baird is the COVID-19 operations chief at Hamilton Public Health and says vaccination continues to be the strongest defense against the virus. With the Ford government looking at the possibility of ending the mask mandate by the end of the month, Hamilton Public Health is asking residents to reflect on what's best for your own personal safety.
Whether that's about receiving vaccine, wearing a mask, being very cognizant and maintaining personal distance, those kinds of things, people still need to do what they need to do to protect themselves.
Right now, the percent positivity of PCR tests in Hamilton stands at 11.2%. Baird says on average, there's been one new hospital admission each day, and since Friday, one Hamilton resident with the virus has died.
Hamilton Public Health Services does continue to report deaths associated with COVID-19, but this trend is decreasing overall.
Ontario relies on wastewater surveillance to analyze virus levels in the community. It's something Hamilton says they will look at after previously saying it didn't support a greater understanding of COVID-19 locally.
We are working with the researchers, and we have some planned meetings coming up in the very near future to better understand where that divide is and understand how we could perhaps use this data going forward.
And there were 1,074 new COVID-19 infections reported through PCR testing across the province today, but with limited access to that PCR testing, Ontario's top doctor says daily case counts are likely 10 times higher than that. Back to you at the desk.